Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hi there. Thanks for joining us for another episode. Today we're talking about a really important topic for all parents, and that's vaping. I think too many of us think that it's safer than it is. We're going to learn a lot today, but as always, let's start off with our parent question.
Hi, I'm Jesse. My 14-year-old son, Sean, told me that everyone at his school vapes and that it's no big deal. I'm worried. What do I need to know about vaping?
Thanks, Jesse, for that really great question. Vaping is a big concern for all of us who are parents, particularly of teenagers like myself. Also, those of us who are clinicians and the health impacts, and even our schools today where much of vaping is happening. Here to help us dive into this topic today is Dr. Alicia Casey. Dr. Casey is a pulmonologist here at Boston Children's Hospital and a lung health expert. Thanks for joining us, Dr. Casey.
Thank you so much for inviting me here today.
Well, before we dive into our topic, I always like to ask our guest experts how you got into the field that you're in today.
So I became a pulmonologist largely because I have asthma myself and I grew up with somebody with cystic fibrosis. And my whole life I was sort of interested in learning more about the lungs. I started to get into the pulmonary complications of vaping, which is part of my job right now, because I was seeing a patient in about 2018 who I thought had diffuse and rare lung disease. And in order to diagnose that, it involves a pretty big workup, which often includes getting a lung biopsy. And so I had done all these studies to try to figure out why the patient was so short of breath and was coughing and had sputum production. And right before we were about to do this more invasive procedure, the lung biopsy, her parents contacted me and said, well, she thinks that it's because she's vaping that she has these symptoms. And I never even asked her about vaping. It kind of blindsided us, actually, because at the time, cigarette use was at an all-time low. And we definitely weren't asking about vaping use as frequently as we do now because we didn't realize what the teens were doing.
And I don't think any of us as parents or as clinicians were really thinking or talking about it.
All of a sudden, the use spiked up and we were really hearing about it first from our patients. As a result, I felt like I had to learn everything I possibly could about vaping. And so I became the supervising doctor with our trainees who was constantly saying, did you ask about vaping? Did you think about vaping? And so I tried to learn as much as possible.
You identified a gap in our knowledge and expertise and just saw that as an opportunity to help provide better care for kids. And I mean, it's really inspiring.
When we started to find out about these cases of electronic and vaping associated lung injury in 2019, people started to come to me to ask questions about vaping. The Mass Medical Society asked me to start speaking out in the public more about this. And then all of a sudden, Governor Baker wanted to learn more about the harms of these devices. And so I started to, go to his office and start to educate them about what we were seeing from a lung standpoint. And then I ended up before the pandemic on the Massachusetts Electronic Cigarettes and Vaping Commission to study and learn more about what the harms were of vaping.
Wow. So it started all with a patient.
Yes.
And I don't think many clinicians anyone was really thinking about vaping as it was evolving and new. And it's really great that you took that opportunity and help kids, because it sounds like the potential harms of vaping is not something that everyone is aware of. We need to know more. So thank you for diving in.
I can thank my patients for
That's awesome. So let's start from the basics of vaping, because I know, again, as a parent of 2 teens, I know of it, but I don't really know a lot about it. I don't know if I'd even recognize a vape. I don't even know if that's what you call it, like if it was in my kid's room. So I'm wondering if you could kind of start at the basics and tell us really what is vaping.
So vaping involves the use of electronic devices. They contain a power source of some kind, which is usually like a rechargeable battery, a heating element, and then the reservoir that contains the liquids that are heated up and then aerosolized and inhaled. They contain either nicotine, THC, the active psychoactive chemical in cannabis.
Marijuana,
And those are marijuana, yep. And then they contain other chemicals, whatever substances are needed to get the nicotine or the cannabis into solution, so it is a liquid. Then they often contain flavoring and other chemicals to make the user experience more pleasurable. In addition to either nicotine or cannabis, they can sometimes contain other things like CBD, some melatonin, B12, various things. And in some studies, they actually found that the devices will say, oh, it doesn't contain any nicotine, but when they studied it, it actually does contain some of those things. And it's not very transparent what are in these things.
Which is scary in and of itself, right?
It's totally unregulated, which is very scary.
Wow.
So, and some of the things that are inside of the devices, when heated, they become something different and they undergo a chemical reaction. You remember from chemistry that when you heat things, they can often become something different. And then we also have to remember that those heating elements can be dangerous, and they that come into contact with the liquids, and they can contain things like heavy metals. And then even the batteries themselves can, because they're not regulated, they can, explode or have things and be damaging as well.
So I'm hearing you say there's stuff that maybe teens don't even know are in there. And then there's these sort of carrier liquids, so to speak, right, that help get the nicotine or the marijuana, the cannabis to be aerosolized, that can also be dangerous in and of themselves.
Yes, it's not just water vapor that we're talking about here. And there is actually potential for the cannabis solution to be even more dangerous because of the chemical properties of cannabis, and that it has to be in like what's called a lipid in order to get it into solution. So lipids are like oils or fats. Yeah, exactly.
And so you're essentially inhaling that into your lungs.
Yes,
that doesn't sound
which
good.
doesn't belong in your lungs.
Yeah.
None of this belongs in your lungs. Only air does. So
it's maybe, more dangerous than maybe many of us know, because I feel like, it's sort of touted, or socially people talk about it as not being as bad as smoking, but it doesn't sound like that's the case.
No, we're definitely learning that it's not the case.
Can you tell us just how common is vaping amongst our kids and adolescents?
Sure. Well, the FDA puts out a National Youth Tobacco Survey, and the data from 2024 shows that currently amongst middle and high school students, 1 in 12 are currently using.
Wow.
And so that's 1 in 10 for high school students and 1 in 20 for middle school students. And when you look at ever use of vaping products, it's 2 in 5 at middle and high school students report that they've ever used vaping products.
Wow.
And the data for cannabis is also concerning, because in the Monitoring for the Future study, that showed that from 2017, about 9.5% of high schoolers were reporting that they were using cannabis products. And that rose in 2020 to 22.1% of high school students.
So it sounds like it's on the rise, despite the growing, or hopefully growing, awareness that this is really unhealthy for kids. Why do you think it's so popular?
Well, when you ask kids some of the reasons why they report that they're using, they report that they're curious about these products. They see their use out, in the world, on social media, and they become curious, and they report that their friends or their family members are using them. We know that marketing exposures encourage use. The more that they're exposed to it, the more likely they are to use. And there's lots of stuff on social media that is completely unregulated that they are seeing, and they think that these products are, cool to use because it glamorizes the use when they see like influencers using them on social media. I've been a pulmonologist for 15, 16 years now. And in that entire time, I saw 2 teenagers acutely sick from using cigarettes. And that was mostly an allergic response in the lungs for those 2 patients. And now, this is a common thing that we see. In order to come to our clinic, the pulmonary complications of vaping, you have to have some kind of respiratory symptom, and in the setting of vaping. And so now in that clinic, which we just started in late 2019, we have over 300 patients that have some sort of respiratory symptom or problem, or they've been hospitalized for a respiratory reason. And that's not very much time that we've been doing this.
Wow. So what is in the vaping, substances that are making it so unsafe? Why we're seeing so many kids needing, true medical help and even potentially hospitalization?
Vaping products contain many things that can be potentially harmful to the lungs. So the first is actually just particulate matter.
What is particulate matter exactly?
So particulate matter is when you see that aerosol that comes from the vaping. There's all these little microscopic droplets and matter that's contained in there that you're inhaling into your lungs, or you're getting secondhand exposure to it. And they've done studies that show when people are vaping indoors, there's actually as much of that particulate matter in the air as there was when we were younger, and they actually allowed combustible cigarette smoke indoors.
So you're saying like secondhand exposure is just as bad in vaping as it is in cigarette smoking?
Potentially.
Wow.
And
that's scary.
It's really
Especially
scary.
when kids are doing it, in schools, and I hear about it happening in bathrooms, right? Because now you're exposing all these kids to that secondhand, I don't know if it's not really smoke, right? Just the particulate matter.
Aerosols.
Yeah.
And in those aerosols, it's not only just the general particulate matter. There's other things like volatile organic compounds, that there's occupational safety standards if that's at your job and it exceeds those levels in some cases. And the flavorings, when they become heated, as I mentioned earlier, they can become different things, and they can become things like toxic aldehydes. And when they've done studies, there's formaldehyde in these, which we know is
used to
embalm. Exactly. And then there's this acrylamide, which is a wastewater treatment product, and diacetyl and other things that are just not healthy for us to inhale. And these are things that parents would never let their kids be exposed to if they knew about it. So,
wow.
And just think about, like, it took us decades to understand what smoking did to the lungs. And these things have really only been popular for maybe at most 10 years now in the United States. And we're learning so much about how harmful these things can be. And we shouldn't let our kids be guinea pigs in testing these things. And also, a lot of parents don't realize how much of nicotine and or cannabis that the kids are being exposed to. Like, one of these vaping devices that they're using can be like a whole entire pack of cigarettes or more as far as the nicotine exposure.
And then on top of it, the substance in it that the kids are, getting, addicted to, the nicotine or the cannabis, it's even more concentrated than maybe previous ways that kids would be exposed.
Exactly. And it can be at high levels. And we even see some of these teens are having symptoms of toxicity of being exposed to nicotine and or the cannabis. And so we see patients who have headaches, difficulty concentrating. They just feel overall sick from the nicotine. And even with the cannabis, we have some teens who are experiencing like GI side effects, or they can have psychiatric symptoms from exposure. And then there's this condition called cannabis hyperemesis, where the kids actually vomit quite a lot.
Wow. And those are all acute issues. Nonetheless, we don't know the long-term issues. And I mean, there's also, this sounds like it's similar to what I've heard kids talk about, something called Nick-sick. So it sounds like the substance concentration is one aspect that leads to these being so highly addictive for kids. But, you know, it also seems like, given the flavoring and all of that, it's almost like it's being sort of, I don't know, billed as not addictive or enjoyable. Can you tell me more about how that impacts kids' ability to just get hooked on these so easily?
Well, the companies who have designed these devices, they've manipulated the products so that they are a more pleasant experience for the teens to use. So a lot of those flavorings that they put in there also increases the perception that these things are not harmful. So if it's things like blue raspberry, lemonade, gummy bears, reinforces that misperception that it is something safe.
It's definitely sort of a confusing thing for kids because, right, I mean, even as parents, like, we think if something's fruit flavored, it's, you know, it's just some type of a kid candy, right? And it doesn't seem as harmful. I mean, cigarette smoking, for example, you know, it doesn't really taste good. Doesn't smell good.
No, exactly. and when we were younger and it was combustible, if you were to inhale that many milligrams of nicotine, for example, it was harsh and irritating to the
cough
back of the back of the throat. Exactly.
Yeah.
But they because they've changed these products, they are actually, like, even the nicotine itself is less harsh to the back of the throat. And they've also changed it so that the particles are so small that they get down deep into the lungs, and they cross into the bloodstream in the lungs more quickly, and they get, you know, a further distribution than a normal cigarette. And then that translates to crossing the blood-brain barrier much more quickly and increases the addiction potential.
Oh, my goodness. So all in all, these things are really dangerous and not good for you. And
definitely not good for you. It's all risk.
How can we help parents approach this topic with their kids and hopefully help prevent getting down this path of vaping?
So the first thing as a parent is to become educated and, you know, listen, read, find out as much information about these things as possible. And then it's really important to talk to your kids and have open, honest conversations with them. It's much better for them to hear about these things first from the parent rather than from their peers who don't have the best information about this.
I try to have conversations with my kids a lot about, you know, exposure to drugs and alcohol, and just, you know, talk to me if anyone comes to you. To the point where my son's like rolls his eyes. I know what you're talking about. He's like, we've already done this. And so, but the thing that I have left off in terms of that conversation is vaping. Like, it was so not in my my sort of my, I don't know what the word is, but in the forefront of my brain to include. But now I know I need to include vaping too.
And it's important when you're having these conversations with your teenagers to set clear expectations and let them know that this is something that you don't want them using and that you're concerned about them using. And you also want to be very supportive in these conversations so that the kids feel that they can ask open questions and that they shouldn't be ashamed of their questions. And you want them to be telling you about what's happening at school.
Yeah, so don't be wishy-washy.
No, not at all.
Make sure your kids know. Because I have also learned that, you know, staying connected with your kids, like, you know, helps. And then, you know, checking in a lot. But also, you know, kids, even though they may not admit it, they kind of do hopefully listen to you in the background. Like, your voice
definitely do.
It sinks in, even though if you can't tell. So being really clear about your stance is probably really, really helpful.
Yeah, and repetitive too, I think. Yeah.
Okay,
so,
good.
Not to the point of annoying them.
Yeah, not to the point of the eye rolling.
Yes.
Okay,
well,
I'm
maybe
working
a
on
little
that.
bit.
I'm working on that. Oh, great. Talking frequently, making sure kids know your stance is really important. But okay, what do we do? What do parents do when their kids either do say they've been exposed, or kids are talking about it, or that it's really no big deal, and they don't really see the concern in vaping?
So when they do that, it's good to understand where are they getting this information from. And you're going to be armed with the information about the harms. And so you want to very calmly try to reset what their misperceptions are about these devices. And you want to talk about the respiratory harms, but also you want to talk about the toxicity harms and the addiction and mental health concerns as well, and try to get them to understand why it is that you're concerned about these things. So
Yeah, and probably some real world examples like the patients you've seen and cared for that have been so, impacted so negatively.
yes, and there's definitely a lot of those real world examples and teens and young adults who are speaking out about how vaping products have harmed them.
Yeah, so looking out for those stories. Maybe also using social media for good as opposed to
Exactly.
for bad might be a
Exactly.
good way to connect with your kids. All right, I like it.
Yeah.
So you mentioned, the impacts on mental health. So can you tell a little bit more?
There are studies that show that teens who are using vaping devices are more likely to experience mental health issues like anxiety, depression, increased thoughts of suicide. So there's definitely a link there. It's hard to know if there are kids that are with mental health concerns are more likely to use these products, but it also may go the other direction, that these products are causing an increase in these mental health issues. And we've definitely seen in our clinic that one very concerning thing is that over and over these teens are reporting that they're withdrawing from positive activities, so things like sports, because they don't feel that they can keep up, they're short of breath, they're just not as interested. Music, other activities they're less likely to participate in, and when they withdraw from that does increase their risk and give them more time to spend vaping. And that's the addiction piece there, where they really just want to engage in this activity because it's giving them the dopamine surge in the teen brain. So
So there's like that physiologic addiction that then prevents them from doing things, and then probably leads to more depression and isolation and maybe anxiety, right? Too. I mean, for
exactly.
teens that withdraw from those activities that they enjoy or that are social. So it sounds like it's a really bad circle, a vicious circle that kids can get into.
It is, yeah.
Oh my gosh. So what are some of the warning signs that we should be aware of to know whether or not our child or adolescent might be vaping?
So you want to look out for parts of these devices in your home. So many of them can look at like flash drives or highlighters or
oh my goodness,
just common things. The batteries are often these small square, silver things that they kind of leave around, and they look like a battery that you would charge for other things in the home. You want to look out for any like unexplained, like fruity and different scents inside their room, or when on their clothes when you're washing them. You want to look out for changes in their behavior, withdrawal, like I said, from positive activities, things that they used to enjoy. And then you also want to look out for new medical symptoms, so both respiratory, but also, some of the other things that we talked about with the toxicities of these devices. So GI symptoms, vomiting, headaches, difficulty concentrate, change in school performance, all of those things can indicate that your teen might be using vaping products.
Wow, and I think that it's really scary to me thinking about the fact that, again, these don't have a bad odor, so you might not pick up on that. And also the fact that these devices, it almost sounds like seems purposeful that they look like common everyday devices, so you don't recognize them.
Yeah, they totally did that on purpose, yeah.
Like, okay, that doesn't look right.
These are much more easily hidden than the bongs were.
Yeah, back in the day. What do you advise for parents to do when they have a suspicion that their child might be vaping?
So the most important thing is to be calm.
Okay.
And there needs to be consequences, but you don't want them to feel that you're being punitive or mean or angry about those consequences. Yeah. And you want to make sure that you understand why they started using this and like what's happening, where are they doing it. Because a lot of this does happen at school and with their friends and in their peer groups. And so you want to understand what's leading to this so that you can help them out of that. And unfortunately, because a lot of their peers and friends are using, sometimes in order to stop, the kids have to change peer groups and so that's a very hard thing for a teen to do. And so you want to understand why and what's happening, because there might be things that the school also has to help with as well.
Okay. Now, so again, that makes sense. Like, try to make that connection, provide that, sort of like open dialogue, because you really want your teen to open up to you so that you can figure out how to help them best. But what are the resources?
I would always start with the pediatrician and letting the pediatrician know that this is happening and asking for advice. There are also programs like Boston Children's adolescent substance use and addiction program that we work very closely with. There's programs like that across the state and across the country. They also can help pediatricians as well. So that's why it's a great idea to start with the pediatrician first. So
yeah, no, I think that's good to know, because I think, again, as a parent, I don't know that I would have necessarily known I could go to my pediatrician for advice and help. And then from there, you can also go to clinics like yours that can really help kids. Is there any situation though where a parent might need to, seek more urgent care?
Oh, yes, absolutely. If your child is experiencing like acute respiratory symptoms, they're really having problems with difficulty breathing, you look at them and they look like they're having increased work of breathing, they have color changes, if they're having like intractable vomiting that we were talking about, you should bring those kids to the emergency room for further evaluation. So
yeah, I mean, that's also really good to know, because I don't know that, again, people are thinking with vaping that there could be this acute respiratory, decompensation that you need to seek emergency care.
Exactly. And usually people think it's related to infection, and sometimes it can be that you got an infection on top of the damage that to the lungs that vaping has done. But definitely those patients need to be seen rather quickly.
Can you tell us a little bit more, too, about what are some of the sort of physiologic impacts of vaping, and specifically respiratory-wise?
Oh, sure. So we have seen so many different respiratory consequences of vaping. The most common one is that many teens who are vaping are experiencing chronic cough, chronic sputum or mucus production. Many complain that they're short of breath or they have chest pain. So those are some of the common symptoms that we see. We've seen patterns of injury really in every compartment of the lungs. So the most extreme case is that electronic and vaping associated lung injury, which we started to notice in late 2019, and we're still seeing cases of that across the country. So that's the most extreme case. But we're also seeing lots of other respiratory issues. And so we are seeing that patients who had asthma and their asthma was kind of quiet for a long time, and then all of a sudden they start using these products and their asthma is worse. We've seen life-threatening asthma exacerbations. We've seen bleeding into the lungs. We've even seen something called pneumothorax or air leak, where the air gets trapped and eventually your lung pops and the air is outside of the chest, which that can be acutely life-threatening. Yes, and they may need a chest tube to deal with it as well. We've seen that allergic response in the lungs called eosinophilic pneumonitis, and many other things that damage where the oxygen gets into the blood as well.
So clearly these substances are not intended to be in your lungs, and they're just kind of wreaking havoc, it sounds like.
Absolutely.
So I'd love to kind of change focus. And I'm curious, Dr. Casey, we always talk about what research is going on. And this is obviously something that's pretty new, right? In terms of like just even our kids being exposed. And now we're learning about, how to prevent it and what harm it causes. So can you tell us a little bit about the research that's going on here at Boston Children's related to vaping?
Yeah, so we're doing clinical research on our patients who present to the clinic, the pulmonary complications of vaping. And we're keeping track of what they are experiencing so that we can report it to others across the country, because we do have a pretty big clinic. We're in that clinic. We're also actually collaborating with people in other places in the country where they're trying to understand what it is that in these vaping devices that are really harming the lungs. With our colleagues in adolescent substance and addiction, we are trying to understand, how do we get kids who are using and addicted to these things, how do we get them to stop? Because we do have some patients that even when they know that they're damaging their lungs, it's still really hard for them to quit. And so we're trying to understand, how do we best do that in teens? And we have both a patient registry in our clinic and a biobank where we can, collect the samples and even collect the products that people are using so that we can study them in the future.
Wow. So it sounds like the research is kind of all across the board, because there's so much to learn still, which is so important. Well, finally, as we wrap up, I always love to ask our guest experts, what, if anything, haven't we talked about that you think is really important for our audience to know?
I think it's really important to talk about the advocacy efforts. There's this great group called Parents Against Vaping. That's a great place for parents to go to learn more about how they can participate in helping to end this and limit this. It's also a great place to go for information. We all care about the environment, but all these devices, they're a lot of toxic trash, and that just gets thrown on the ground or in the trash bags, and that is not helping our environment.
Yeah, so the impact is so multifactorial in terms of all of the aspects of vaping. Well, thank you so much for this conversation today. It was really helpful, and I know I learned a lot, and I know you're going to help a lot of parents and a lot of teens out there, so thank you. Now it's time to move on to the fun part of the conversation, which is doctor's orders. And this is where you, as our expert, are able to prescribe an action that parents can take today to help raise healthy kids. Dr. Casey, what are your doctor's orders?
Pay attention and try to prevent this as much as possible. Talk to your kids early, often, and openly about this. Know what the risks are, and make it so that they are able to talk with you. Set a strong example, and remember, an ounce of prevention is worth a pound of cure when it comes to vaping.
Really great advice, Dr. Casey. Thank you so much for sharing your time and your expertise. I know it's going to help so many kids.
Thank you so much for inviting me today.
Thanks for listening to Boston Children's Answers Parentcast. And special thanks to our guest parent, Jessie, and our guest expert, Dr. Alicia Casey. See you next time.